Hello, today we will be discussing a patient with complaints of back pain. So we have JK, date of birth 6/15/1985, 39-year-old female, African American, presents to the clinic alone and appears to be a reliable historian. Per patient, chief complaint, as stated, is my lower back has been hurting for the past 2 weeks. She characterizes it as constant aches and rates it a 6 out of 10, aggravated by standing, bending, and lifting heavy things. She complains of occasional acute pain that radiates to her left buttock, but denies any numbness, tingling, and weakness in the leg. She is a cashier and comments that the discomfort in her leg becomes more serious when she works for long hours. The patient has no history of trauma in the past, no recent falls, no fever, no bowel or bladder incontinence. She has been taking ibuprofen over the counter with little effect. She is worried that the pain is not getting any better and that it is interfering with her job performance. In regards to past medical history, she does have hypertension that was diagnosed 5 years ago, obesity with a BMI of 31, and no other previous back injuries were reported. Surgical history includes a C-section in 2008 and a cholecystectomy in 2016. She has no known drug allergies. Current medications that she is taking is lisinopril 10 milligrams daily and ibuprofen 400 milligrams as needed for pain. She denies any tobacco, alcohol, or illicit drug use. She does work full-time as a grocery store cashier, often standing for 8-hour shifts. She lives with her husband and 2 children. In regards to family history, mother is 62, alive with hypertension and diabetes. Father is 65, alive with hypertension. And sister is 40 years old, alive, and has history of hypothyroidism. In regards to the review of systems, she denies any fever, chills, weight loss, or fatigue. Musculoskeletal is positive for lower back pain, negative for any joint swelling or redness elsewhere. Her vital signs are temperature of 98.4, her pulse is a 78, her respiratory rate is 16, her blood pressure is 128/80. Her O2 saturation is 99 on room air. She is 5'4". She weighs 185 pounds, and again, her BMI is 31. All right, so in regards to the musculoskeletal, so on inspection, there's no visible deformity or swelling of the lumbar spine. Palpation, we do notice some tenderness over the L4, L5 paraspinal muscles. The range of motion, she has limited flexion and extension due to pain. Lateral bending is within normal limits. Straight leg raise are negative bilaterally, and her gait is normal and steady. In regards to the differential diagnosis, I'm going to say mechanical lower back pain would be the most likely diagnosis. This is most frequent etiology of adult with lower back pain, typically of musculoskeletal origin, and is aggravated by activity and alleviated by rest. Another differential diagnosis would be lumbar strain or sprain, common in individuals with repetitive bending, lifting, and poor posture. Given that the patient works at a grocery store, it is likely that she is bending and lifting frequently. Also includes muscle spasms and tenderness over the paraspinal muscles, which this could also be a possibility. And another differential diagnosis would be a herniated lumbar disc. It's less probable as part of the negative straight leg raise test and without radicular symptoms, but transient mild sharp pain may present minimal or early disc involvement. So I'm going to say the definitive diagnosis is mechanical lower back pain. In regards to diagnostics, we're not going to do any imaging as of now because this is considered acute lower back pain without any red flags. We're going to do in the future we will do lumbar spine x-ray or an MRI if the symptoms persist over 6 weeks or if there are any neurological signs or indications. As far as pharmacologic treatment, we're going to continue with ibuprofen. She could do anywhere from 400 to 600 milligrams every 6 to 8 hours with meals, no more than 2,400 milligrams daily. We're going to do a short course of a muscle relaxant like cyclobenzaprine, 5 milligrams TID as needed for muscle spasms. For non-pharmacological, we're going to suggest some altered activity, encourage gentle mobilization, and prevent prolonged bed rest or prolonged standing. We're going to advise her to use heat or cold packs on the lower back for 20 minutes, 3 times a day. And then we're also going to encourage her to start with slow stretches and straightening the core. Referral to physical therapy, if not better within 2 weeks, will also be done. I want to educate the patient on the importance of maintaining mobility and avoiding prolonged inactivity, which may worsen symptoms. So we want to have a good balance between having the patient standing, walking, and sitting. We also want to make sure we teach her proper lifting procedures and adjust her posture at work. We want to go ahead and counsel her on NSAID usage and accompanying side effects such as gastritis. Make sure that she is taking this medication with meals. And we also want to inform her to watch out for increased pain, weakness, numbness, loss of control over bladder and bowels. We want to ensure that she goes to the ER if these were to happen. We want her to follow up in 2 weeks or earlier if the patient is worsening. And we want her to follow up with us so that we could refer her to physical therapy in the case that she has no improvement. And again, emergency treatment for any change in neurology, acute increase in pain, or bowel and bladder dysfunction. Thank you so much.